Welcome to the presentation on muscular injuries, and in this one we're going to focus on functional muscle disorders. What we will cover in this learning: we're going to have a quick recap of the sports injury theory from your level 3 sports massage. We're going to then discuss what a functional muscle disorder is, and it's all based on the Munich consensus, which we discussed in the factors and risk factors of injury. And then we're going to focus on what the sports massage guidelines are for a functional muscle disorder. So firstly, the recap from what we learned in the level 3. So we focused on muscle and tendon strains, and that's about the overstretching of a tissue which causes the muscle fibers, tendons, blood vessels and fascia to tear. What we had learned and covered before is that there are 3 grades of a muscle and tendon strain. Grade 1 is less than 5% of the muscle fibers involved. There's no loss of function or strength, and only a low-grade inflammatory response. Grade 2 is where a partial rupture had occurred, and that's more than 5% of the muscle that's involved. There is definitely some tissue damage, and strength and function of that particular muscle is reduced. And then grade 3 is a complete tear or rupture, which incurs a complete loss of strength and function. So this is a really simple classification of muscle and tendon injuries, but what it doesn't really factor in is all of those types of painful experiences that your clients may be experiencing that aren't related to a tear of muscle fibers or a rupture of the muscle, which is where the Munich consensus comes in and starts to classify muscle pain and injury even further with different options or possibilities or diagnoses of what may be happening. So let's look at what comes out of the Munich consensus in terms of functional muscle disorders. So this section is taken from the Munich consensus. And as you can see, it really starts to break down muscle injuries in a little bit more detail than just a grade 1 to 3 strain. So if you start at the very beginning on the left hand side, so you can see A and B, which are based on those intrinsic and extrinsic risk factors. So you have an indirect muscle disorder or injury or a direct muscle injury. And then from there, it starts to break it down. So let's start with the indirect muscle disorder or injury, as that's what we're going to focus on. So the first thing we're going to cover is the functional muscle disorder. So as you can see, the indirect has already been broken down into 2 different types of injuries. So let's focus on the functional muscle disorder. And then it breaks it down into other areas as well. So the first one, type 1, is an overexertion muscle disorder. And this is what we will really see in clinic quite often. So there's no sign of tissue damage or injury, but the client's been experiencing pain, tightness, or fatigue in a particular area. And then type 2 is the neuromuscular disorders. That's taken into account any nerve issues and nerve disorders alongside any of the muscle disorders that the client may be experiencing. So let's start to look at those in a little bit more detail. So the etiology of a functional muscle disorder is it's acute. It's an indirect issue. There's no direct muscle injury that's occurred. There is no macroscopic evidence of a muscle tear. It's often multifactorial, so it could be caused by lots of different things, and it does limit function. And if you think about many clients that you may see in clinic already, they may be experiencing symptoms such as this. So an indirect issue, function may be limited, but there's no evidence of a tear or an injury to the muscle, and they've not been diagnosed with a muscle or tendon strain. So let's begin looking at a fatigue-induced muscle disorder. So that's type 1A. So these are some of the signs and symptoms that your clients may be experiencing, or you may see in your subjective and your objective assessments. So the first one is a sign of fatigue. So when you're doing your injury assessments, the client may not be able to maintain that pressure, and there may not be pain, but they don't have that strength, so the muscles may be tired. There may be a loss of function within the muscles as well. You may see an increased muscle tone within that muscle as the whole muscle is affected. So maybe some hypertonicity in that muscle. But what your client may experience is a feeling of stiffness or tightness, or perceived stiffness or tightness. They may feel that the muscle might be achy during or after exercise, that they can't do the exercise or activities as much as they want to, so maybe some loss of function. But the key indicator also is that there's no incident or injury that's created pain. It's just gradually appeared. That stiffness and tightness or achy feeling has gradually appeared. So it's a gradual onset. And in your clinic, as a level 3 sports massage therapist, I would predict that you've seen lots and lots of these types of clients with this type of fatigue-induced muscle disorder, rather than any particular muscle strain or tendon strain. And the second type of functional muscle disorder is a delayed onset muscle soreness. So the signs and symptoms that the client may be experiencing is pain after unaccustomed exercise. So if they're not used to exercising or they've increased the intensity of exercise, often after endurance activities and eccentric loading movements. It can affect the whole muscle or area, and there may sometimes be some inflammation present from DOMS. And some of the words that your client may describe this as a feeling is stiff and weak muscles, pain after exercise when they're resting, and pain when the muscle contracts. In your level 3, we discussed DOMS in lots of detail about what we think is happening. And what we think now is it's definitely due to a fatigue within the muscle rather than more lactic acid being present. And this is the information education we really want to get across to our clients when they are experiencing DOMS, that it is a sign of fatigue. Next, we're looking at spine-related neuromuscular disorders. So that's disorders that are located along the spine. So the signs and symptoms are that it affects a muscle bundle along the erector spinae or the other spinal muscles. There may be increase of muscle tone in the area, and it's pain or it's sensitive on palpation. And if you've done your injury assessments with your clients and you've ruled out any of those red flags or those contraindications, and your client is experiencing pain, such as lower back pain, then this may possibly be what is happening. Your clients may describe it as pain in a specific area. So I often find with this, it's a pain often in the lower back area, quite close to the spine itself. They don't feel any pain when they're resting, but they feel pain when they're moving. And if they feel it or they press the area, it's sensitive, or they may describe it as being painful. And then another branch of the neuromuscular disorders is a muscle-related neuromuscular disorder. So this is where it affects a muscle bundle in a specific area. There's an increased amount of tone in that area, and then be pain or sensitivity on palpation. Now, the Munich consensus doesn't really discuss trigger points in the document or within the meeting that they had. However, there may be a link between trigger points and this muscle-related neuromuscular disorder. Your clients may describe this as an achy area, but it's quite specific. It may feel a little bit like cramp. There's a firmness to the area, and it's sensitive or sometimes painful when they press the area. So let's go back to what a functional muscle disorder is. So it's something that's acute. There's an indirect component to it. There's no macroscopic evidence of a muscle tear. So you've done your injury assessments and there's no sign of a muscle injury. There's no sign of a specific issue or injury that occurred to create the pain or sensitivity that your client's experiencing. There may be more muscle tone, but their function is limited and the client is experiencing pain. So what may cause these functional muscle disorders? There could be an element of overtraining. If your client has increased their training for a particular event or activity, are they training too much? Are they getting that adequate rest? And that's a discussion that you can have with them about their current training plan. And if you are qualified to prescribe exercise, you can look at their training program, or you can then chat with whoever is prescribing their program to help support them a little bit further. We cover overtraining in quite a lot of detail in the injury prevention module, which is coming over a little bit later. But for now, just have a chat about overtraining with your client, about the type of training that they are currently doing, and see if you can make any suggestions or recommendations. The next one of a possible cause may be deconditioned tissues. So how strong is your client? Is your client built for endurance, for the activities that they are trying to take part in? And that's often the case with these types of functional muscle disorders, is there may be a deconditioned element to the muscles. The common example is that tight hamstring feeling, which I think we all have seen within our clinic, where your clients experience tight hamstrings over and over again. They keep stretching, they have massages, and it eases a little bit, but it never really goes. And the muscles, the hamstrings, when you feel the hamstrings, are quite hypertonic. There's lots and lots of muscle tone in that area. So what that client would need, apart from the massage, is some really good specific conditioning exercises for increasing strength within the hamstrings. But again, that's all based on your subjective and objective assessments. But that's a client that is quite commonly seen within clinic that experiences those perceived feelings of tight hamstrings. The next one is fatigue, and I think this really encompasses both overtraining and deconditioned, and how quickly their muscles fatigue when your clients are exercising or doing those everyday activities. So again, it's about the question about the type of training and the amount of training that they're doing alongside the strength and the endurance of the muscles. And then lastly is nutrition. And nutrition is really important for the health and quality of our tissues. If you've already watched and completed the nutrition module, then you will know the importance of nutrition for a healing perspective, but also for a quality and a strength element to the tissues. So you can ask your clients questions about their nutrition, what they're eating, because that can have an impact on the functional muscle disorder that they may be experiencing. So let's move on to the goal for your client that is experiencing a functional muscle disorder or potential functional muscle disorder. So the goal is to help them move without pain, help them return to movement and sport as quickly as possible. And sports massage is great for helping to move without pain and then supporting them through that movement to get them back to that activity, whatever they want to do without pain. And some of the benefits for sports massage for functional muscle disorders are pain reduction. So we know that massage can reduce pain, which helps then improve how your client's feeling, which increases the chance of them increasing their activity for that particular part of the body. It helps calm the nervous system down to help reduce that pain. It can help increase that range of movement by thinking about techniques such as muscle energy technique if the muscles are quite hypertonic, or trigger points if there is a neuromuscular element to what they've been experiencing. But I think the global reason for sports massage is it helps create that pain-free window for home care, because we want to get those clients moving and building strength in those muscles as quickly as possible, especially if there is a fatigue or a deconditioned element to the functional muscle disorder. So we want to reduce their pain by creating that pain-free window through massage and then get them moving as quickly as possible. So if you suspect your client may be experiencing this, always start with a good client history to find out all of the factors involved. Consider what has happened, why it may have happened, and it's really important that you discount any signs of red flags or global or local contraindications to what your client's been experiencing, and to rule out any of those before you go into any of the assessments. You want to assess the range of movement of the joint that's involved. Use those injury assessments that we cover later on in the course to find out what may be happening. Check for signs of inflammation, any inflammatory responses, and treat those differently. And as with everything, always refer for a diagnosis if required. So if there's something you aren't sure about, get that referral from a physiotherapist, from an allied health professional to give you that diagnosis of what may be happening if you aren't sure. So let's look at some of those massage techniques that may help. Effleurage and petrissage are wonderful to kind of calm that area down initially, calm that nervous system down. As many of the disorders suggest there may be some excess muscle tone, so if you see that within your client's muscles, then using the muscle energy techniques can really help reduce that excess muscle tone. Soft tissue release, both longitudinal and transverse, can help reduce pain and improve that range of movement at the joint. As you mentioned, there may be a trigger point element to some of the neuromuscular issues, so using that trigger point on that bands of tight tissue for pain reduction. Positional release, the new technique, can help restore ease, affect the nervous system, and improve that range of movement at joints. And then passive stretching can help reduce pain and desensitize for DOMS as well. So you've got quite a lot of tools in your toolbox that can help with the functional muscle disorders. And the key is to knowing which techniques are used best based on what you find in your subjective and your objective assessments. And it's important to note that we need to think about the whole body and treating your client as a whole person. So what else may be happening to create this fatigue-induced pain? Is there any posture, movement restrictions causing any of those aggravating factors? So make sure you spend lots of time on those subjective and objective assessments to get a real big picture of what may be happening for your client. Other massage modalities may help if you're qualified to apply these techniques in these specific areas. So using instrument-assisted massage can be really good as a desensitization, especially if you want to add some movement in to help that client improve how they're moving and build that strength. And if things are quite tender and quite sore, again, kinesiology taping can help with that pain reduction and also help with muscle activation if an area is desensitized or deconditioned. But as with those, always ensure that you are qualified and insured to use those techniques. So we don't teach you on the level for how to use them, but if you already have done courses, then you can integrate them into your treatments. And the big thing for this is looking at the home care. So asking your client about their training schedule. Is there an element of overtraining or undertraining? We want to use movement to be able to help improve that range of movement and strength where required and maintain what they are doing with you in your massage sessions. Discuss nutrition, as this may have an impact on the fatigue, but also within the boundaries of what you are qualified to discuss. And if your client is feeling fatigued, then discuss rest and relaxation, because that could be really good home care for someone who is overtraining, stressed, and also fatigued. I love this quote, and I think it fits really nicely when we're discussing those functional muscle disorders. An ounce of prevention is worth a pound of cure. So focusing on prevention for your client. So looking at those other strategies like training, the training schedule, rest and relaxation, nutrition, adequate movement and mobility can all create prevention of any of these muscle disorders. And here are some of the reading and resources that can help you progress and learn more within this area.